Okay, welcome back. Our next session is, just to round up before we go on to a break, is around expanding business intelligence, and our use case is CHIE. CHIE have been a really valuable partner for us because they represent the first of type for Discover in the UK, and currently the only customer live with Discover in the UK. And we work very, very closely with Katharine, who I'll allow to introduce herself in due course, to get Discover up and running from a shared care record analysis perspective. So just for those of you who are not aware, I'm going to do a few slides on what Discover is, and then introduce Katharine. So Discover is our analytics product. We've referenced it in some of the sessions we've covered today already. It reports on data persisted, essentially stored within the Orion Health platform, and it can be implemented in a number of ways to support clinical use cases or administrative use cases. And the instance we're talking about today is very much administrative. So how are users logging into and accessing the shared care record? Here is an illustration of one of the dashboards that we have, and Katharine has lots of wonderful examples of these, so I won't dwell here. But I guess the point being that they're interactive. We've got different visuals available within the dashboard. You can filter dashboards, and they've got lots of key information. The example here is of login activity, so it enables you to analyze how different users are logging into the application and where from. Discover for us is broken down into different modules. So the bits highlighted in bold are what are in place at CHIE, Discover Core, so a data warehouse where the data gets stored, and Discover Portal, the dashboards that enable you to report on usage of the shared care record. These are some of the other modules that we offer. Clinical demographics, encounter, and pathways go into more patient-fronted or based use cases. So for example, in the illustration we gave in the previous session, that was using one of the Discover clinical dashboards to do some of the breast screening analysis that got patients into a collaborative work list. We also have Discover Desktop for more mature users, and I think that might be on the cards. We'll talk about it later. So Discover Desktop enables you to configure your own dashboards or to configure existing dashboards to meet your own use cases. And then Discover DID is closely aligned to the capability that Kevin talked us through. This is the least pretty slide that I've got today. This is just a very indicative reference architecture for Discover. On the right-hand side, at the left-hand side as you're looking at it, the Orion Health platform that you currently have in place, the shared care record, that's where you're logging into. The Discover database, where the data warehouse resides, is physically separated from that for performance reasons, but we have our own inbuilt SSOs so that users logging into the shared care record can access those dashboards seamlessly within the shared care record platform. And that's all that's really there to illustrate. Now, a final slide, we love maturity models at Orion Health. This will be the second or third one you've seen today. This one focuses on analytics specifically, and it's just to indicate that, again, where CHIE is in the foundational stages. We recommend that every customer who worked with Discover starts there because you need a data warehouse at the core of your solution. You don't necessarily have to follow these steps. You could jump into a DID use case if you have the data sets available, but this just shows some of the capabilities. So moving up the chart, I guess, working with local users, we can ascertain data sets that you might want to persist within the platform, clinical data sets that you might want to derive reports from, and work through a process of data ingestion around those. You can evolve in the Discover library to the types of dashboards that you're using, and also use Discover Desktop to build your own. DID we've touched on. You can always build out the data section dashboards that you're working with, because there are always going to be more reporting use cases. And then right up in the top right-hand corner, we have the PHM predictive space, which is very closely aligned to some of the stuff that Kevin told us about. Document Tagger, Smart Coder, that's using natural language processing, and also the machine learning manager as well. So that, I guess, just puts, hopefully in context, some of the capability that we have. But the focus of this afternoon's session is really around the starting blocks, the foundation, which are essential to get you going in that direction. So I'll hand over to Katharine to talk us through CHIE.
Thank you, Bruce. Okay, good afternoon. My name is Katharine Guthrie. I work for CHIE. Those of you who don't know, CHIE is the shared care record for Hampshire and Isle of Wight ICS. We have been around for quite a long time, since 2003, under a variety of different names. I like to say we're the biggest shared record in the UK. I'm not totally convinced we are anymore, but we do have around 12,000 users, unique users per month, looking at over 200,000 records. So we're quite a meaty system. So we work for the Hampshire and Isle of Wight ICB. It's a medium-sized ICB, about 2 million citizens. We've got 4 big acute trusts, 2 community mental health trusts, over 140 GP surgeries, and then, as you can see, a large number of care homes and domiciliary care providers, and then various other smaller organisations that interact with us, including 4 local authorities. So we are a true shared health and care record. We are a right-only system. As I said, we've been around since 2003, and we went live on the Orion Health platform in 2001, so right in the middle of COVID. So we took all our information, 18 years worth, and the whole system, and moved it through the whole pandemic. So that was fun. What did we do then? Well, we got Discover because it came with the core Orion package. But immediately I realised it was going to be something that I, as an engagement manager, could put to good use, working with all our partners to keep them engaged during that transition period. So what did we need to know? Well, we wanted to know what our usage patterns were across the whole patch. We wanted to know, were there patterns of upward growth or conversely downwards once we'd gone live on the Orion platform? When were people using the system? Was it just during core hours, or was there going to be a bigger need for extra service support out of hours? We honestly didn't know. We knew we were going to have to start sending some quite detailed national returns for figures about usage, but we also wanted to give all our partner organisations regular updates on what their usage was looking at, and also what their users were viewing in the system. We wanted to be able to identify clearly the users that were logging in through single sign-on, but also the cohort of users that were going in through the web portal. And one of the key reasons was to try and identify users that were logging in through the web but perhaps could be moved over to single sign-on, and also to look at whether there were some big chunks of users from particular organisations we could then put on our roadmap for development of single sign-on in the future. We wanted to know if there are any trends around successful logins against failed logins, and although the CHIE team, we're quite small, but we're all quite experienced, we have a range of diverse careers and backgrounds, so we needed something that anybody in the team could use, whether they were technical, non-technical, clinical, it didn't matter. It just needed to be something that was simple, intuitive, and that we all felt confident to demonstrate to our partners. So what did we do? Well, we started doing some regular meetings with Bruce and his colleagues, and we started with some really small things, and this sounds really simple, and they probably were, but they made a big difference to how we sold this project on to our partners and got them to start looking at it. So, for example, this chart shows the usage, what people are looking at. And when we first got it, all those axes on the left-hand side were all exactly the same. So for the bigger numbers, it looked great. For the smaller numbers, it all just looked like flat lines. And when you give that to a busy clinician, they just go, oh, I don't know what that means. That's not telling me anything. So that was one of the first things we did. We just said we want some dynamic reactive axes on any dashboards that use that type of layout. So that was the first thing. The next thing is we needed to be able to search for all our users. Now, the information we get on our users from our partners differs greatly. Another conversation we're going to definitely have with them about that. But our BAU team needs to be able to search for users really easily, to be able to start audits or even to just reset passwords. And some of the fields we need to search those users weren't there. So what we did, we made sure we introduced some more search fields. Again, quite a simple thing, but for our BAU team, just made life so much easier. We changed our date search functionality. So the standard default was an anchored date. So you could search within a date range from today backwards. So you could look at a month ago, 6 months ago, a quarter ago. quite nice, but then if someone came up and said, oh, could you run me something for the 3rd to the 10th of July, we couldn't do it. So one of the first things, again, we did was ask the developers to put in just a standard date range, and we can do that now. One of the other things we did was loaded in the whole, this is probably a mistake, UK ODS code set so that we could start building more information around our organisations. It was a slight error. It's so big that it's really become unwieldy, so we're going to do some more work on that. But it really helped us when we started our rollout to care homes to be able to have that organisation information there in a coded way so we could report on it. So we ended up with that. Bruce showed you that. This is our main statistics dashboard. It's split into 4 sections. I'm still not 100% happy with it, and I think Bruce would agree. We want to do some more work, especially in that, down in that left-hand corner around roles and who's using the system. We only really have 2 RBACs, so that one down the left doesn't really tell us very much. But what does tell us quite a lot is that top left-hand one, which is looking at our SSO usage against our web portal. And the one on the bottom right-hand side, again, is the one that we obviously like to show our partners quite often, which is our numbers of patient records. And you can see a nice trend line going up there. This data was actually run right from our go live, which was back in April last year, up to the end of August this year, which is, if you're wondering why the numbers on the top line are so big. And I mentioned before we needed to be able to send figures nationally, so we submit ours up through the Wessex Care Records programme every month, and we need to be able to just do that at a tap of a button. So that top layer of that statistics dashboard does give you that information, and I'm just highlighting a couple of our key metrics there that we send off every month, and obviously they're bigger numbers because that's the whole go live period. I mentioned earlier about seeing log on time. So this report I ran, I think this was for a month, looking at usage by our ambulance trust and our 111 service and our 2 out of our GP providers in Hampshire Isle of Wight. We're always being told nobody uses the system out of hours. Well, if you can see that the darkest squares are the heaviest usage going through to the lightest, you can see that actually there's some clumps there of quite heavy usage out of that normal 9 to 5 working day. Now, going forward, that's going to help our department, our team, look at, are we staffing that support service correctly? Do we need to talk to our partners about how we provide that IT support in a better way, especially as more and more of those types of services come on board? Not going to go, no. I mentioned failed and unsuccessful logons. So this was looking at a month's or a year's worth of data for our 2 community and mental health trusts, who are 2 of our biggest users. I had a chuckle with this, with our BAU colleague over there. We identified straight away where the blips were. They're right after the school holidays. And that's because we've got all our users forgetting their passwords. So I think, that didn't tell us anything new in this instance, but it certainly proves that the data is accurate and is following those trends. We can also see what people are looking at. So for this example, I've just chosen a random GP surgery and just thought we'd have a look at what are their top 10 screens that I'm looking at. And I spoke to my our GP colleague, our clinical lead, Emma, and she agreed that looked fairly standard across the board for primary care. And then I drilled down a bit further. I looked at the application filter and just filtered that by our 2 social care fees to see whether our GP practices are looking at social care. We often get told, oh, I don't think anybody looks at the social care data. Well, I think you can see there that's blatantly not true. It's a core part of the data set that's held within CHIE. And I really like this one. This is our overall usage trend chart. So I've run this here for Hampshire, I think that's Hampshire County Council. So that's showing the portal users and the SSO users. And that's showing the amount of patient records viewed against the amount of patients and the amount of users. And as you can see, although we've got those little blips around the holiday time, we're still seeing a steady upward trend. Here I looked at our care homes. this was referenced earlier, and I think someone was talking about a CHIE, especially us using the multi-factor authentication to be able to roll out to care homes. People often say, well, what are they using it for? So using this, we can actually drill down and see what data they are actually checking for their residents. Unsurprisingly, it does tend to be the medications, the discharge information. So when Jane Smith is heading to them in the patient transport, they can get onto CHIE and have a look and get some history about her. And some of the feedback we've had about that has been really, really positive. So the other thing, of course, is reporting. I also mentioned the headline statistics we can get out, but we can also download lots of data from nearly all the dashboards that are available to us. And this one I've run here was just for a user report. I just, again, chose a GP surgery at random for a month and just looked at who was using the system, which accounts were active, which were disabled, which were new. And then, at a push of a button, we can download that data. So we can download to a PowerPoint, to a PDF. I normally choose the data one because then that gives me the option to download that into a CSV. So if I have Southern Health Community Trust saying, I want to know who's using CHIE, we're not convinced that certain teams are using it, I can go in, download this data, and send it to them in an easily manipulated file format, and they can play with that as much as they want then. Also, though, I will add that a lot of the screens and dashboards do have a built-in report view as well. And I found this really useful for when I'm doing demos or catch-up sessions with partners, and I can actually show them live on the screen, and we can flick between them without having to download stuff into Excel. And it's just quite a nice viewable formats, and I'd quite like to play around with that a little bit more in the future. So what's next? Well, obviously, I've shown you this slide before, but for this one, I've actually chosen our 4 main acute trusts, who are generally our biggest users. Now, that's great, but what the system does at the moment is add all that information together, so it's showing the total usage for all those 4. What we'd like to see next is that split out into separate graphs, so we can see their usage relative to each other. It's not a competition, but it sort of is in Hampshire, especially in the acute. They do like to sort of keep an eye on who's doing what. But I think that is really useful to see if there are any trends in areas and see if if you look at it in conjunction with your login trends, login success and failures, that's quite useful data there. So that's going to be one of our next developments. And the other one that I'd really like to, I mentioned care homes. So we've got over 600 care homes in Hampshire Isle of Wight. 161 have access to CHIE. Not all of them use it regularly, but 161 have access, and that's growing on a weekly basis. At the moment, if I want to report on all of them, I do have to go in and select the individual ones that I want to look at. What we're going to do is, now we've got that ODS code set in, is we can start building in extra filters. So we have an organisation filter that will then map to that ODS code set. We are going to configure that code set. We realise it's so unwieldy. We can't just keep it to Hampshire Isle of Wight organisations, because we have organisations out of the area that provide commission services to citizens in Hampshire Isle of Wight. But what we've done is we've done a baseline of all the organisations we know that do use the system. That's going to, they're going to configure the code set to just include those, and then we're setting up a standard operating procedure with the Orion help desk so that we can tick it whenever a new organisation joins, and it just gets added in. So it'll be a dynamic list, and I just think that will just speed up our BAU team's process. One of my colleagues is sat over there, and I know I've watched how long it can take to load sometimes, because it's a huge list, as you can appreciate. We're still doing our fortnightly update, I think, aren't we? We're going to carry on with those. And Bruce did mention about the desktop version, so that's something that we're already thinking about. I did mention earlier about MFA. We talked about it a bit earlier. And whilst what I'm going to show you next isn't directly connected to what I've just been talking about, we just thought it'd be nice to show you. So we've been working on a case study with Orion Health and Hyla Marketing around the benefits of CHIE to care homes. We're very much going to use it to encourage other care homes to come and register and engage with us. You're the first people to see it. I believe that's right, Katie. So it is starring a couple of the CHIE team, but mostly it is focusing on the residents and managers and families in the care homes. It's only about 2 minutes long, and that will take us into coffee. And then if you want to come and speak to any of the CHIE team about this afterwards, we'd love to meet you.
A shared care record really is a collection of data about a patient where somebody might be interacting with different care services across Hampshire and Isle of Wight. What a shared care record does is brings that data together into a single space across those care settings. Last year we went live with the Orion Health solution, and in Hampshire and Isle of Wight we call that the Care and Health Information Exchange, or CHIE, and we're now deploying that to our care homes. The benefits are fairly profound.
Before CHIE, my staff used to spend a lot of time on the phone to hospitals, GP surgeries, multidisciplinary teams. So it's just as fast as a click and we can get that information.
The data is most usefully around medications, allergy information, particularly for new admissions where they might not have the history of that resident.
It's been brilliant because I can click on it, and when residents come in and they've come from home, they don't obviously have a discharge summary. Somebody might have diabetes that they haven't necessarily told us when they've moved in, so then we can link it to their digital restore news score and we can access everything we need from there.
Data security, very important with the NHS, and very important to make sure that patient records are only accessed by the right people. So we've implemented multi-factor authentication, which is where the user enters their username and password, and they also need to enter a one-time passcode which is sent to their device. Very much like the same way that you use in other banking and secure apps.
By definition, people who are moving into a care home are vulnerable in one way or another. They might be frail, or they might have not much memory, or they might have difficulties communicating. So a few weeks ago, Mum had a blood test, and a few days after that, I phoned the surgery and I was on hold for 15 minutes. But now they've got the CHIE system, they can also see immediately what the results are. So I think that's a huge benefit, is having immediate access to things.
I feel much more confident using CHIE. I've got access to residents' medical history. It means that I can deliver the correct care. It means that I know everything about everybody that comes into the building, and it means nothing's missed.
Well, my family, they all live in Kent, and I know here they inform them on different things that's happening, and I'll be more relaxed because I know that I can go to management team and they will be able to help me.
I've recently become a manager. For me, it's a godsend because residents come in and I have to do all their care plans, and I'm also medication lead, so it just makes it so much easier for me.
In the new digital social care programme, our new ethos is more time to care. So by providing care homes access to CHIE, they become part of that growing data sharing world that we now are in the NHS.
I would say definitely get to know CHIE, understand it, have a play around with it, learn about it, get it into your care home as quick as you can. It stops the waiting times and it ensures that our residents get the best care they can.